Hi, welcome to Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Jeff Jones. Jeff is a licensed counselor and the founder of the Family Recovery Solution and Family Addiction Engagement Training. Jeff is also very passionate about helping families navigate the complexities of addiction recovery and decreasing the daily deaths, which are sadly related to this devastating illness. Welcome to Addiction Recovery Place podcast, Jeff. It's great to have you with us today.
Well, thank you very much, Chris. And yeah, I appreciate that introduction and specifically the connection between families and reducing the number of deaths. So, yeah, I'm glad to be here. Thank you.
Absolutely. Well, I'm really looking forward to talking to you today and hearing about your amazing service that you provide. So we're just going to dive straight in, Jeff. Can you tell us about yourself and how you started the Family Recovery Solution, please?
Yeah, sure. So my story that drives me comes from my childhood. And there was no active addiction in my family of origin. I mean, my mom had some eating issues, but at that time it wasn't really connected. It wasn't seen as addiction. But my mom's father, my grandfather, showered more love and attention upon me than anybody in my whole life. On the other side of it, my grandfather and my mom had a complex relationship where she hated him, quite frankly, and something happened between them, some kind of trauma that she never talked about throughout her whole life. And for me, that was very confusing because I loved them both and it didn't feel safe to love my grandfather in my mom's presence. And it was many years later that I really, asked questions about the complexity of that. And I was just curious. I did my own drug and alcohol journey when I was younger, but it wasn't really harrowing to where I had to go to a treatment center. As a therapist, I was doing DUI groups and heard stories over and over from people that inspired me to go, Jeff, you're taking too much risk. Just going out to, the restaurant with some friends and having a couple beers and a burger and chatting it up. So I really thank a lot of people in these DUI groups for sharing their story and it's finally getting in to me. But I held questions from a child as how does the family become a part of the solution here, which I'm going to be talking about. And the other question, which is another conversation, is how do people actually get better? And that was a question that I saw once I worked in, the industry and saw kind of the revolving door. That was a question. But anyhow, that's a little bit of my backstory. So when I became a therapist, I focused on families and addiction and eventually was super curious, like why families kind of get marginalized. A lot of times they're the ones that get people into treatment, but then they get kind of pushed to the side or marginalized. And there was a lot of the shaming language and stuff like that really, it just didn't fit for me, and it didn't fit my experience of being in a family with addiction.
Mm-hmm. Yep. Goodness me. Yeah. I mean, families play such a pivotal role in recovery. I'm a true believer in this. So how does your program work and how does the family of someone experiencing addiction get involved?
So, in some ways, the program is pretty simple, but it flies against face of the way we normally see addiction in families. I mean, normally the focus is on that one person and getting them to change and pushing them and having hard conversations and probably arguments. And what I've done is I've expanded the focus from that one person to include family addiction education early and as soon as possible. And so that's kind of the main emphasis here is family addiction education as early as possible. And I know that's hard for families because of all the stigma and stuff like that. However, I want people to know that I've done a lot in this expanding to show that this problem didn't start with you. And really the underlying factor here is love, because how do families 1,000 miles that way and 1,000 miles that way that don't know one another, how do they know to do the same wrong thing? Well, it's love, So, but anyhow, family addiction education early, and then incremental family change. Like once the family learns some things and they see some of these bigger patterns that they've kind of fallen into, they have an opportunity to make change, and their brain is working better than the individual who's in addiction. So it's like eventually they can make change. And of course, the education comes with coaching. But then the next step is families start changing. They incrementally change their communication and offers to their loved one. And ideally, so everyone can live beyond addiction. And, so I may have said that, very simply, and we both know that it's not simple. And yet a lot of different things happen. And, but that's kind of short answer to your question.
Yeah. You mentioned a word just then, which comes up in every one of my podcasts, and it's stigma. Why do you think stigma has such a pivotal role in stopping someone entering treatment? Because it's, in this day and age, it's to me, it's very strange that we're still having this thing that's stopping people engaging because of just that one thing.
Yeah. Well, I mean, we're still using language and thought process and understanding from hundreds, if not thousands of years ago. And it's like, many centuries ago, like the Egyptians thought flogging was a cure to drunkenness. And it's like, really? And the Turks thought a cure would be pouring molten lead down the throat. And that was a cure, like lead poisoning, potentially death. But it's like crazy stuff. And then it was like a moral issue, and it was a choice, and now it's a disease. And so but there's still a lot of that old thinking, which results in shaming and stigma, and that's a bad person, and that's a bad family. And so that's largely, I'm glad you asked that question, Chris, because that's largely one of the biggest challenges that I'm having.
Yeah. Yeah. I guess from your very short history lesson then, Jeff, that we have progressed somewhat with stigma, but from what you were telling me what the Egyptians were doing compared to now, I guess there's some movement here, but to me, it just frustrates me still. So I guess what you just explained to me kind of shows that we have moved on as a society slightly, but I think there's still a very, very long way to go. And what you're doing with your family addiction engagement program is showing this. So you have 6 sessions of the program, Jeff, and I'd love you to go through each of these just to tell our audience how this works.
Yeah, sure. Well, so, and I'll try to do this very succinctly, and feel free to ask more questions along the way. But so the first session is I expand out here to mixed messages in the culture about addiction. And it isn't so important that we identify each mixed message. It's important to know that are there, and then they trickle down into the family systems. And there's all kinds of patterns that show up in family systems. And so that's the second session. And then third session is to recognize impact, that family members recognize how they have been affected. And so the third session has stuff in there about adrenal fatigue, and, that eventually can lead to GI issues, gut issues. But there's nutritional interventions in the third session. And so my addiction nutrition mentor, some of the stuff I learned from her, I have brought into session 3 and session 4. And session 4 is about power and recognizing patterns of power, like our own power, how we use power, or do we put someone else above us, or do we put ourselves above them? But it's like really looking at and understanding how power is used in individual relationships and how it kind of manifests into how families do family together, because there isn't just one way to do family. And I'm a big proponent on, I don't tell people what they need to do. I provide information and coaching to help them make their best decision. So power is session 4. Session 5 is about communication. And specifically I focus on, different ways to communicate, to provide offers, set boundaries, and essentially incrementally move towards more and more boundaries. So a big part of this whole process is incremental change for the family. And then session 6 is kind of bringing it all together.
Yes. You touched on something earlier that was really interesting that I've never really come across before, the nutritional side of things, and kind of how that plays such a part in. Can you just explain to me a little bit more about that? Because that was really interesting about that.
Yeah. Well, in the beginning, and when I said I've held 2 questions, for a very, very long time. And one was, how do people actually get better? And what I have seen, how people actually can get better is to heal the reward deficiency pathway that people with abnormal genetics are most prone to. So it's genetics. And then when they have an environment that turns those genes on, they have a greater tendency to addiction. And so amino acids, supplements can start to heal that reward pathway. And, I wrote a Substack article about the reward deficiency pathway. And it's at the end of it, I have some links. And what I find interesting is that not many people even know the concept of reward deficiency syndrome, which Dr. Ken Blum did the research for. I find it very interesting that Dr. Ken Blum did this research in the 80s on reward deficiency syndrome, and that's not really all that well known in the addiction recovery space. The whole nutritional piece has that focus, healing the reward pathway, healing it with the biochemical part of it with supplements, but then the other part of it is all of the recovery skills that we know and love. So it's, who we hang out with, what we do, what we think about. Are we able to catch our own faulty thinking or our own BS. Whereas AA says, denial, don't even know I'm lying to myself. And then the other part of it is the whole spiritual part. When individuals start working on all three of those, they can get better. The traditional recovery thing oftentimes forgets about the biochemical piece, or there's an assumption that pharmaceuticals are going to take care of that.
So when you start working with families, how do you approach a family that may be a little bit resistant towards, this new approach? Because it's a very interesting program that you've got, and I think, obviously families that have gone through someone who's going through an addiction could be very frustrated by the point they get to you. So do you ever find much resistance at all?
I find quite a lot of resistance, quite frankly. And I think the norm is for families to try and do their very best. But a lot of times what that looks like is doing some of the same stuff over and over again, and they don't see these patterns that have trickled down. They oftentimes use the same strategies, get the same results, and they're super frustrated. And generally with roles in the family, there's different roles, and so they see the situation differently. They have a different relationship with their loved one who's still using. They have a different thought process and strategy. And generally, if the child is the one who is still using, it's the mom who doesn't give up. Yeah. And they're in the role of the savior, the rescuer, the codependent, the enabler. I don't like those. I don't like the label enabler.
Absolutely. Yep.
Saying enabling in the addiction recovery space. We all know what that is. And what I say is, hey, I'm always enabling something. I can either be enabling old patterns that reinforce addiction, or I can be enabling health. But it really takes discerning the difference. So when I initially talk to people, generally they don't come to me until they're totally burnt out. It's just one person. It's not the whole family. And they've been in and out of many horrific situations. I mean, I want to say, I'm sorry that our system works that way. And I'm trying to change it, quite frankly.
Yeah. So do you find when family members have gone through your program at the end, I mean, it must be such a weight off their shoulders when they see a light at the end of the tunnel, if that makes sense. And it must be so rewarding for you to know that you've already helped many, many families get through this pathway.
Well, I do feel a lot of gratitude from people. People that go through this program, they start making some changes. We continue to have a relationship, and different things happen. And at some point, they have a better understanding as to what they need to do, how they can make their own best decision, as opposed to what I've seen is coaches, like in a general way, like what I'm doing, they just tell people what to do, and they can help people get out of a situation. But when like a chaotic situation happens next, then what are you going to do? Or like, I don't want people to be dependent on me, but it takes a long time for people to change, because I see that our thinking process has been kind of, we're still back in, maybe not in the flogging and pouring molten lead down the throat, but addiction, there is changing way quicker than our understanding. Because when I was, it was mainly alcohol or cigarette. That was it.
Yep.
Marijuana. which I didn't really hear about or know about, but that's been around a long time. And oh my God, there's so many different things can feed the reward pathway, illegal and legal substances. And going back to the nutrition and food and the reward pathway, like sugar is primarily one of the biggest ones. Like, I've stopped drinking, but I'm eating a lot of sugar, and they just gained 70 pounds or something. And I've heard of sponsorers who actually say, carry sugar in your pocket to their sponsees. They tell them this: if you ever feel like drinking, have some sugar.
Wow.
And so they get this blood sugar spike, and it does help in the moment, but there's a way to deal with blood sugar, and like one of the amino acids that I use specifically for that. And it's just a beginning, but that's glutamine. So there are numerous strategies here. Protein too. So glutamine and a protein bar can be your first aid kit for early recovery.
Yeah, that's really interesting. I didn't know. Obviously I knew about the sugar and alcohol and things, but I didn't realize that having an easy kind of quick fix, if you have those kind of crashes, that can be a benefit. That's really interesting stuff. How long do you work with families for, would you say, on average?
Well, unlike the norm kind of thinking out there, my left one just goes to a treatment center for 30, 60, 90, then they're going to come home and they're going to be fit. They have the problem, and we, the family, don't have to do anything. Now, I see that as problematic thinking, and I see that dividing a wedge between the individual in early recovery and the family, because the family's still doing a lot of these same patterns, the same back and forth relation, and the same way they do family together, which can contribute if someone comes back from a treatment center and they really want to practice everything they learned, they can fly back into their old role and potentially easier, and the family can be enabling these old patterns that reinforce addiction. I see recovery as more of a 3 to 5 year process.
Yeah.
And so, ideally, I work with families for years. And initially, the family addiction engagement training, these 6 sessions, which is, I have it in a 4-month program right now. 2 weeks for every session, because there's field work. There's things to do at the end of every session. It is listen to this video or read this PDF, and then you'll be fine. It isn't like that. So the whole change process, I see, takes a while. And once someone gets into early recovery, and if they want to go the biochemical route with amino acid coaching and nutrition that rebuilds the nutrients that addiction broke down, if they want to go that route, there's a lot that I can offer. And I give referrals to people who have the same training that I do in the Academy for Mental Health and Addiction Nutrition, or maybe it's addiction and mental health nutrition. I always kind of get that confused. But it's like then the individual can start to have facilitated communication with their family and talk about what they're doing, how they're progressing, and have regular meetings. And then once the individual says that, then the family has an opportunity. Oh, well, that's great. It's good you're doing that. But what's this? There's this other thing, specifically when it's partners or a spouse. So, I have long-term programs like 3 years, a year, And I also start with like the training, which is kind of a family's first model for families to get education while their loved ones still use it.
Well, I could just imagine the relief it must be to some family members who are almost given up hope to find your program, because it puts a whole new slant on things and a whole new angle for recovery.
I agree with what you're saying, Chris. And one of my biggest challenges here, treatment centers have this program to coach families before their loved one is even ready, which is why I'm doing webinars for professionals as well as families. And then on the back end, before the individual gets treatment center, they can actually begin this structured community. And these ongoing meetings can be a area of accountability and talking about what's really true. And what I love about the structured time to do that, it isn't like, the family, the individual can have boundaries with their family and okay, every Wednesday at 4:00, for instance, we're going to have these meetings, but I don't want you like broadsiding me every time I come home. What about that? Did you stop off the bar? All of that help rebuilding trust.
Yeah. Mm-hmm. Most definitely. It's been fascinating stuff. This really is. How can a family member or professional contact you to access the program or to talk about the program with you?
Well, the simple way is through my website, the familyrecoverysolution.com, and people can sign up for a webinar, the alcohol bio quiz for underlying, and they can also sign up to have free conversation with me. So that would kind of be the easiest first connect with.
Yeah, wonderful stuff. Last couple of questions. I ask all my guests this question because I get some really interesting and varied answers. But can you tell me your opinion of what harm reduction is and how it can play a pivotal role within recovery?
Thank you for the question. I like that question because harm reduction goes to the grain, abstinence only kind of thing. Harm reduction, which in some ways, when I was learning about harm reduction can be, from a sexual contact standpoint, can be using condoms as opposed to not using condoms.
Yes. Yep.
The whole family addiction engagement training, this incremental step-by-step part of it is, in my mind, kind of a harm reduction approach.
Definitely.
But families are incrementally changing the harm that they allow in their family. So I love the concept. I'm very much both and thinker. Abstinence, I know there's been many people who their life has been saved with abstinence. And I know that's important, and underlying understanding the underlying abnormal, and I really get why some people can never drink, and why other people they just might be able to. So the harm reduction concept, I love it because instead of just black and white thinking, it's abstinence or nothing. It's both and thinking, and let me just try this and see and learn. But from the standpoint of alcohol, harm reduction, I really question that because of what I was telling you, Dr. Blum's research. And just within the last month or two, there's a program out in San Francisco that got grant to do harm reduction with alcohol. And I thought, boy, from the standpoint of the underlying genetic, I'm not sure this is money and time well spent.
Mm-hmm.
And I would love to follow up with that program. So there's my answer to
Fantastic.
harm reduction. It's a huge question. I love the both and.
Yeah.
Thank you for asking.
No, that was wonderful. Thank you for explaining that to me, Jeff. Last question. Do you have a message for anyone listening to this podcast who's going through addiction or a mental health trauma?
Like many mental health issues are, mild, moderate, severe. So they incrementally kind of build up. And my encouragement to people listening to this podcast is for families to go against the cultural grain and to reach out sooner rather than later, and be aware if they reach out to the traditional kind of approaches, they may feel the shame and blame and that kind of thing. So that's my message.
Yep. Wow. Well, that's a perfect way to end today's podcast, Jeff. Thank you so much for your time today. It's been really interesting. It's been a real privilege and honor to talk to you, to find out about what you're doing. It really is very powerful stuff. And I'd suggest anyone to listening to this who wants to find out more to contact Jeff directly. So thank you very much indeed. Much appreciated.